The Obama administration has touted itself as being the transparent administration, and they've issued a statement from the Attorney General about transparency throughout the administration, and the FDA had a hearing last year on transparency, and yet they're not transparent at all. You know, they don't let people know when they're going to speak until the last minute. People now know which day they're going to speak at, but not what time they're going to speak. They posted all their documents on the website on the last Friday before a hearing on Tuesday, giving people at the most 2 business days to read through these things if they had nothing to do. And I'm sure they had those documents long before that. So in essence, they're kind of ambushing everything. Nobody knew who the panel was until Friday, and it turns out it's filled with dentists. Dentists have a limited practice to the oral health and the effect that that has, but not whether or not mercury causes Alzheimer's disease, or mercury causes ALS, or mercury causes MS. In fact, there's lots of science that it probably is a factor in those diseases, along with hearing loss, kidney loss, everything else. But who are dentists to be making that decision? Now, the FDA says, probably going to say, well, that doesn't matter because there's not going to be a vote. Well, who are they to advise you? Who is a panel of non-dentists to advise you? There are some other people on this panel, but they're non-voting people. Michael Ashner was on the panel in 2006, and he's on this panel again, and he's eminently qualified to look at these issues. He's a PhD, not an MD, but he has studied these, published on these things, and is well versed on them. But he's not a voting member. Dental filling material, from the standpoint of toxicology, that's what it's all about. That's what the safety of this stuff's about, is the toxic effects of it. And the FDA has ignored that, and the ADA has tried to say it doesn't exist. But the ADA, when they get sued, says, we're a trade organization, we owe no duty to the public. But when somebody says mercury fillings may be bad, the ADA says, oh, they're good. Well, either you don't owe a duty to the public and you shouldn't be saying anything about the public, or you do owe a duty to the public.